So I would like to move House File 349 for re-referral to the Committee on Commerce. So the bill is before us. Representative Harrison, can you introduce yourself and proceed with the testimony?
Thank you, Madam Chair. And Madam Chair, if you would be able, there also is an A5 amendment. It is an author's amendment. If you would be willing to move that amendment, and then I would be in the shape that I would like.
We want to entertain the motion on the A5 amendment. Anyone all in support of the amendment, say aye.
Aye. Aye. Aye.
Representative Edison moves the A5 amendment. All in favor?
Aye.
Aye.
All opposed? Any discussion? The amendment is moved.
We're just enthusiastic bunch of.
All right, to Representative Harrison, please proceed.
Thank you, Madam Chair, and members of the committee. I'm very pleased to be here today and kick off the first of three bills that are going to address youth smoking in the state of Minnesota and the impact and the cost of tobacco use in the state of Minnesota. Minnesota, as we all know, has really been a leader as a state in terms of curbing youth tobacco use and access to tobacco, and we've seen incredible results over the years. Over the last 25 years, youth smoking rates have declined tremendously. And unfortunately, Minnesota is starting to lose some ground to the tobacco companies. And so we bring these bills forward today to make sure that Minnesota maintains its status as a leader in health and a leader in preventing youth from starting to smoke. I do want to thank right away the bipartisan group of authors that have signed on to this bill. It's really a joy to be able to work across the aisle when it comes to issues like the health of our kids. So thanks to all the authors, many of whom are here in this room, for signing on. Before I jump into the specifics of House File 349, I do want to just give a little context in general on the background of smoking in Minnesota. As I said, we've made great progress. In fact, in 2014, the Minnesota Youth Tobacco Survey found that the number of high schoolers who had used a tobacco product in the last 30 days was down to under 25%, which is the lowest rate since the year 2000. But we also know that the tobacco industry is relentless when it comes to targeting our kids, and they can continue to invest in new marketing tactics and new products to keep people addicted and to gain new customers, mostly teenagers and young people and vulnerable populations. And predictably, as a result of the huge onslaught of marketing and new products, our progress to reduce tobacco use is now slipping. In 2017, our youth tobacco rates went up for the first time in a generation. Youth are now using tobacco products like Juul that are flavored, easy to hide, and contain incredibly high levels of nicotine. One Juul cartridge can contain enough nicotine to equal a pack of cigarettes. One small cartridge. And kids are using these every day in our schools, in our parks, and around the state. And yesterday, the U.S. Centers for Disease Control and Prevention released new data on the vaping epidemic. The CDC reports that there were 1.5 million more current youth e-cigarette users in 2018 than in 2017. 1.5 million kids took up e-cigarettes in 1 year. From 2017 to 2018, there was a 38% increase in high school students using any tobacco products. And the latest data from the 2017 Minnesota Youth Tobacco Survey found that 1 in 5 high school students is using e-cigarettes, and nearly 40% have tried them. Let that sink in. Think about the number of kids that is in your districts, in your communities, or even in your household. It's alarming enough, but I think that if we had taken the survey more recently, we would find the numbers are higher when we look at the national data and the fact that youth e-cigarette uptake is increasing so rapidly. The tobacco companies have engaged for years in tactics to lure kids to tobacco, and they're doubling down on those efforts today. And we're seeing an uptake in tobacco product use among kids in rates that we haven't seen for decades. The approaches are not new. It's the same old wolf, different sheep's clothing. They say that their product is safer. They say that they are going to reduce harm. They flavor their products in flavors like gummy bear and unicorn poop, which is supposed to taste like Skittles. They use cartoons in their marketing. And we know these are tactics to target youth because of the historic lawsuits that Minnesota was involved in against the tobacco companies, where they had to open up their records to show how they were targeting youth. So the evidence is very clear. Our youth are being targeted. A recent study found that Juul, which dominates the e-cigarette market, explicitly marketed to youth, especially in the 6 months after they started up. They continue to directly market to youth for more than 2 years while addicting thousands upon thousands of high school students. They know where they'll be found by kids, and they pay for social media and attract users by online advertising. Now, some people dismiss the threat, saying that e-cigarettes are safer than combustible tobacco, but that's really giving us a false choice of what we're going to addict our kids to. The other thing is that nicotine is a health threat. If you've got kids ingesting that much nicotine that is in a Juul cartridge, they are having direct impacts on their brain development. There is strong neuroscience that shows an impact on brain development by the use of nicotine. In addition, anybody who uses e-cigarettes is also putting their cardiovascular system at risk, because we know that nicotine directly leads to atherosclerosis. E-cigarette vapor contains dangerous chemicals like formaldehyde, heavy metals, and other cancer-causing agents. The research also shows us that once kids start using e-cigarettes, they are much more likely to experiment with other tobacco products. Youth who use e-cigarettes are 2 times more likely to smoke cigarettes in the future. Somebody once said to me, I'd much rather find e-cigarettes in my kid's sock drawer than a pack of cigarettes. And I think that what the evidence shows us is that if you find e-cigarettes in your sock drawer, your kid's sock drawer one day, you're going to be finding combustible tobacco products another day. The U.S. Surgeon General warns that nicotine exposure does prime the brain for other addictions. We have also seen these kinds of tactics from the industry before, convincing us that their products are less harmful. We saw this with the marketing of light and mild cigarettes, which have now been prohibited. We also saw it in famous advertisements saying that doctors tended to choose Camels. I'm not buying the harm reduction arguments of e-cigarettes. These are strong addictive substances, and we know that they're marketing to our kids. E-cigarettes are not quit smoking tools, no matter what people tell you. The e-cigarette manufacturers sued the FDA, so they did not have to be regulated as quit smoking tools. So under their own admission, they're not a quit smoking tool. But the other thing is that quit smoking tools are regulated by the FDA. They're science and evidence-based. You use them with your doctor. E-cigarettes are simply another tool for addiction, and our kids are the target. House File 349 before you adds e-cigarettes to Minnesota's clean indoor air protections. The purpose of the bill is to protect employees and the public, not only from the hazards of secondhand smoke, but also from involuntary exposure to aerosol from e-cigarettes. Currently, e-cigarettes containing nicotine are classified as tobacco products under state and federal law for tax purposes and youth access. However, there's a loophole in the Clean Indoor Air Act that does not cover e-cigarettes. This bill expands the definition of smoking to ensure that Minnesota's smoke-free air laws cover e-cigarettes wherever smoking is already prohibited. The expanded definition also ensures we're doing our best to cover the new products we're seeing now and anticipating into the future. The fact is, when I first came to the legislature, many people didn't even know what an e-cigarette was. I learned about it at an addiction conference when they were talking about brain development, and I got on the phone to MDH and I said, what is going on with the e-cigarette market? And it's grown that quickly. That was in 2013. And so we're trying our best through this legislation to anticipate what other products might be coming. We know we can't anticipate them all, but we do anticipate things like marijuana or other synthetic type products that could be vaped or smoked. Over 50 communities around the state have actually already incorporated e-cigarettes into their clean indoor air laws, and it's time for the rest of the state to be covered under these protections. It's an epidemic that we need to address, and we know that good public policy helps us reduce rates of smoking and helps reduce access and interest by our youth. And so I thank you all for being part of this hearing and considering this bill. And I would like to introduce Emily Wyatt to give a little bit more background from the American Cancer Society.
Welcome to the committee, Ms. Wyatt. Can you please reintroduce yourself
Yeah.
and begin your testimony?
Thank you, Madam Chair. I appreciate the opportunity to testify in favor of Representative Halverson's bill. My name's Emily Myatt, and I'm the Government Relations Director for the American Cancer Society Cancer Action Network, the nonpartisan, nonprofit advocacy affiliate of the American Cancer Society. I'm here today representing Minnesota's cancer patients and survivors, many whom suffer from tobacco-related cancers. I'm also appearing on behalf of Minnesotans for a Smoke-Free Generation, a coalition of 60 organizations supporting this legislation. We include the American Heart Association, Clearway Minnesota, North Point, the health plans, many provider groups, and the St. Paul Area Chamber of Commerce. Many of these organizations helped to fight to pass the Freedom to Breathe Act in 2007. Some of you might remember the controversy that once surrounded the law and how it took years to pass. But that controversy is also surprising because today, freedom to breathe is one of the most popular policies our state has ever seen. Minnesotans of all stripes agree that the legislature made the right call by prohibiting smoking indoors. It's a fact that the health of Minnesota is benefiting from freedom to breathe. Studies have found a decrease in exposure to the carcinogens found in secondhand smoke, as well as a reduction in heart attacks, which can be directly attributed to the law. The use of e-cigarettes in workplaces, including restaurants and bars, can undermine the public health benefits that continue to be achieved by freedom to breathe. We also know that the public wants e-cigarettes added to the law. In December, Blue Cross and Blue Shield of Minnesota conducted a statewide poll on the issue. Over 80% of Minnesotans support prohibiting e-cigarettes where smoking is already prohibited. It's hard to find any issue with such universal statewide support. In the same poll, nearly everyone, 98%, agreed that nicotine is harmful for young people, and they're right. Back in 2014, only a handful of communities have passed local policies adding e-cigarettes to their clean indoor air law, including Duluth and Mankato. City officials from these communities have testified that these policies have not hurt businesses. And since then, 50 more communities across the state have followed suit. When the 2007 law was written, e-cigarettes were practically unheard of. Its authors couldn't have imagined a time when 1 in 5 Minnesota students would report using e-cigarettes regularly. However, that's what we're facing today. Thankfully, the overwhelming public support for strengthening our clean indoor air reinforces that the proposal before you is wanted by the people of Minnesota. E-cigarette use is skyrocketing, and people do not want them to encroach on the clean air they've enjoyed and come to expect in public places for over a decade. And they don't want their kids exposed to a behavior that glamorizes and renormalizes nicotine and tobacco use. Included in your packet are letters of support from our coalition, as well as from the Building Owners and Managers Association and from the League of Minnesota Cities. You'll also find additional info on the poll methodology. I urge you to support this legislation. Thank you.
Thank you for your testimony. Representative Harrison, do you have any other testifiers? Ms. Cap O'Rourke? Please introduce yourself and continue with your testimony.
Thank you. Members, my name is Cap O'Rourke, and I work with a coalition of small business owners in Minnesota that manufacture and sell e-cigarette products or vapor products. I would like to just clarify a few points that were made by the chair. So e-cigarette products, vapor products came on the market around 2008 or 9. Right now, it is probably about a $4 to $5 billion industry in the United States, the majority of which are actually sold by small business owners. Despite reports that Juul is the dominant player in the market, which they are within the convenience stores, the majority of these products are sold in small shops throughout the country and manufactured by small businesses, and are often not actually sold in convenience stores. Our concern with the including vapor into the Clean Indoor Air Act, while we respect a lot of businesses, specifically those in bars and restaurants who have made the decision to prohibit using vaporizer products in there, our average customer is 38 years old, had smoked for 20 plus years, and has tried multiple quit attempts to fail. Oftentimes, they have found that e-cigarettes and vapor products do actually help them down the road to quitting, and our products differentiate themselves because they're able to scale back the nicotine over time. Not all products on the market are able to go down to, we even have products that are at 0, and a number of adults who are using these products and using them at 0 successfully to stay off cigarettes. So when we've had, our concern is not necessarily with the bars and restaurants that everyone talks about, but it's more in the more common workplaces. You have a 20-year smoker who has successfully quit cigarettes for a period of time and is probably using their vapor device in their office or in their work location. And they're now told that that is not the case, and they're going to have to go outside and smoke or vape next to the smokers. This is putting them in the exact same carcinogens and dangerous chemicals that they took 20 years to get off of. And on the counterpoint, people would say, yes, but now you are subjecting other people to those same carcinogens or concerns and the chemicals coming out of vapor. The reality is, and the science actually is, that according to the CDC and according to the California Department of Health, who have both done indoor air studies in vapor shops where people were vaping and using these products for an entire workday, there was nothing that reached any dangerous level of any of the formaldehydes, the acetylides, any of the carcinogens, the nicotines. They were all well below OSHA standards for even nominal standards. And so the science that we had when we passed the Clean Indoor Air Act for smoking was overwhelming of the carcinogens and dangerous toxins that we were exposing people to. The science on vapor products, truthfully, is just simply not there on the level of toxins that may or may not be in the vapor product. In fact, the science says they're not there. These products are currently being prescribed overseas. They're currently being embraced in the UK as a cessation model. And so when we pass policies like this, it sends a message, as the author just said, that if you are using smoking cigarettes and you're considering using vapor products, the harm is the same. And the data just is not there. So we think including this in the Clean Indoor Air Act is going to send the wrong message and will put those people who have used vapor successfully to quit smoking back out next to the people who are smoking, and it will not have the same effect, and they could go back to smoking. So thank you.
Okay, thank you for your testimony. Do we have any additional testifiers from members in the audience? No. Okay. Have any questions from the members? Representative Loeffler.
Well, thank you, Madam Chair, and I'm delighted that this bill is here, and thank you, Representative Halverson, for bringing it forward. And I recall in past testimony when we've discussed this topic that we've had testimony from a lot of people who make their own mixes and sell it on the retail market. And there is no knowledge really of what they're doing, what additives they're adding, at what levels. It is not a standardized product. And are you aware that that's still a practice in the marketplace today in Minnesota?
Representative Halverson.
Madam Chair and Representative Loeffler, I know of no new regulations at the state level that provide for information regarding what goes into the consumer vaping products. We also don't have any standards of what's imported from overseas or testing. In fact, what we do know is that very often when products are tested, products that claim to have lower levels of nicotine or no nicotine actually are not labeled correctly. So there really aren't standards or rigorous oversight for that.
Representative.
Thank you, Madam Chair, and thank you, Representative Halverson. That was my understanding as well, that this is really kind of the Wild West, and we actually don't know, even the users don't know what they're exposing themselves to, let alone others.
Yeah, and you know, I remember having this conversation too in this body a few years back when we was looking at menthol, nicotine, and having this conversation about the e-cigarettes, whether or not they was hazardous for you or whether or not they really had nicotine in them. You know, and now the news is a few years later that not only do they have nicotine, but one e-cigarette equal a pack of cigarettes. You know, so I just want to thank you for bringing this bill forward. You know, as we had this discussion around cigarettes back then, you know, someone want to smoke, go outside. You know, go outside and, you know, but the impact it has on individuals and the secondhand smoke, you know, is something that we need to be discussing here in a bill like this is what we need to have, just requiring establishments to ask their patrons to take the e-cigarette outside. And so, again, just thank you. This is a bipartisan bill, and every now and then we get these good bills that come before us, like this one today. So do we have any other questions? Hearing none. Representative, the chair renews her motion to pass House File 349 and refer it to the, yes, oh, okay, to re-refer it to the Committee on Commerce. All in favor, say aye.
Aye.
All opposed? House File 349 is on its way to the Committee of Commerce. Thank you so much.
Madam Chair.